In the atmosphere of this beautiful city of Edinburgh, we're witnessing a very special event this week with the iCAN Research and Advocacy Summit. We're seeing young people and their parents and families discovering their voice and taking the time to learn and develop strategies and tools to ensure that that voice is heard loudly and clearly. Those young people and their families are also developing important partnerships and collaborations that will help to ensure that that voice is prolonged and heard loudly across the pediatric research and health community.
The iCAN Summit is an international organisation bringing together young persons advisory groups from all over the world who act as advocates for children in research.
The iCAN Summit has been really exciting for me to attend today. Today's been the first day I've been at the conference, but I haven't been to one before. And in my academic life, I can't think of another time where I've had the opportunity and occasion to talk to this many young people who aren't already in an academic role.
The purpose of the conference is to allow children to really become involved in direct and clinical trials from the outset. So by bringing the pharma companies, the clinical research organisations and the investigators together with the young people, they can see how they can add value to the trials. By making the trials more patient-centred and more acceptable to children and families, then we have a better recruitment to clinical trials. And recruitment to clinical trials at the end of the day is a target we're all trying to achieve.
I'm sure there are other conferences of a similar nature to iCAN, but I think that this one is really interesting and unique because it's the only one that I attend where children are really the focus of the conference and they are participating in everything, and it really focuses all about them and what they can do.
It's really, really important to make sure that we're designing trials for young people and children to take part in that are relevant to them. So we're answering questions that are important for them. We're treating symptoms which are important for them. And the only way we really know that is if we talk to them and get their guidance.
I feel like this is one way to be able to connect with people all across the globe, really. So, and we all have a similar mindset and we all want to help other people, which has been super invigorating.
As we talk about more personalised medicine, we need to think about what the communities need rather than what we think they need. And we're only really going to be able to do that by going out and asking people. And I think that iCAN has given these young people the knowledge they need in order to be consulted on that.
Historically, industry has sometimes been guilty of assuming that they know what's best for the patient. And I think where iCAN and groups such as iCAN are important is that they can input into us developing better trials. And better trials means ultimately better results for the patients.
So our research is really trying to understand what do children think is the best formulation for them, and can we therefore make medicines in that formulation. And it's been an overlooked science in many respects, in that drugs have been made for a long time now. Drugs for children are just being made more specifically for them. But one aspect that hasn't been really attended to is finding out from children and young people what is actually acceptable to them.
Well, it's my first time taking part in this event, and it's quite amazing.
Well, it's because it's the young children who are doing the trials and in the studies, and it's their health and well-being, so they should be in charge of their own lifestyle.
3 words that I would say to sum up this event: inspirational, enthusiasm, and excitement.
Empowering, engaging, and educational.
Engaging, informative, and inspiring.
Interesting, educational, and empowering.
Magic, unexpected, and awesome.